All right, let's talk about concussions. That's a hot topic today. Let's talk about concussions and post-concussion syndrome. A concussion is when something causes your brain to bruise and swell because your head got hit or jerked around. But the same symptoms of a concussion are the same symptoms you get from a spine misalignment, especially the upper or middle neck. A lot of times we find the same symptomatology, and a lot of times when people have post-concussion syndrome, it's they've got a spinal misalignment that hasn't been corrected. I'm dating myself. Some of you youngsters might not know this, but in 1985, the Chicago Bears won the Super Bowl, and their quarterback was Jim McMahon, and he was a tough, hard-nosed guy, and he wasn't afraid to stick his head in there and get hit. But anyway, he suffered from a lot of concussions and a lot of the symptoms of brain fog and couldn't think straight and mood swings and all these things that can go along with concussion damage. And when he got his neck corrected by a corrective chiropractor, all of a sudden he said the fog lifted, the pressure came off, and he's much better now. So it just goes to show you that if with kids especially, or anytime if you've had a concussion, there's a real good chance, or you hit your head on the dashboard, there's a real good chance you have a neck misalignment. And it's an easy thing to check, and it's what we do, and it's how we correct things. So, why are people sick and in pain? Let's use this for an example, and let's just say this is you. Now, do you think this chimney's working right? Obviously not. I bet you they have a problem with their windows, and I bet you there's leaking, and I'm sure that door doesn't open really well, and the garage door doesn't work right, and I bet the shingles are tearing apart too. Well, what's really wrong with this house? Exactly, it's got a foundation problem. So in other words, no matter what we do to treat the garage door or the front door or the chimney, if we don't fix the foundation, it's just going to cause the problem to come right back. Same thing with you. If we can get to the foundation, remember the structure I showed you where we talked about the baseline of health and the pillars of health, if we can get the baseline right, the cool thing about your body is a lot of this stuff will take care of itself and heal itself. And what doesn't, once you correct it or deal with it, now that your foundation's right and you're working right, it's not an ongoing treatment thing, it's a corrective thing. And that's really important. So, for those of you who don't know or aren't patients here, what makes what we do different is rather than just you come in and we crack or pop your spine all over your spine all the time, which sometimes feels really good, but it's not that the goal of care is just to reduce muscle spasms and to ease pain and all that. We want to correct the spine so it works properly once and for all, and then just maintain it, which takes very little work to do. So we use thermography, where we measure temperature in your spine, which really measures how your nervous system's working. We use specific x-rays from 3 directions to see exactly how that top bone's misaligned. And then we use spinal structural x-rays to see where you are from the front and side compared to normal, and we know what normal is supposed to look like. We use video fluoroscopy, which is basically a motion x-ray of your spine. It shows us exactly where things are locked and not moving. It takes the guesswork out. We know exactly where to work and where not to, when and when not to, because more isn't better. Specific is better. And then we do leg checks and palpation, and we check your posture, and we do things to manage on a per visit basis. But there's a lot of what I like to describe this as is triangulation. We're trying to hone in, just like in the military, exactly on our target, so we can take your spine from where it is to as ideal as it can be, so you can be as optimally healthy and function properly. And these what we call the secondary conditions, or the symptoms that are caused from the misaligned spine and the nerve pressure, can take care of themselves. So the key to all this, which makes this different than almost all forms of healthcare, is what we in chiropractic call innate intelligence. You can call it what you want to, but it's that inner wisdom, energy, power that took you from a sperm and an egg to 70 trillion cells. If we turn these lights off and all of our eyes dilate, that happens because there's an innate intelligence in each one of us that knows how to do that. What did you have for lunch today? Sandwich? Okay. Are you thinking about digesting it right now? No, of course not. your body's doing that on its own. That's not an educated thing. It just knows what to do. It knows when to give you a fever. It knows when to make you sleepy. It knows when to tell you when it's hungry and thirsty. And it knows exactly what it needs to do. And this flows and runs through the nervous system. So if the nervous system is pinched off, even though it wants to tell your body or an organ or something how to work properly, if it can't get through, then it can't tell it that. So we're really dealing with the life and the intelligence and the God-given wisdom that the body needs to know what it needs to do, because your body knows what it needs way more than Johns Hopkins or the Mayo Clinic or Dr. Youngblood. I always like to throw myself in there with those guys. But Dr. You, the innate intelligence in your body, knows exactly what it needs to do if it's not interfered with and it can work properly. But most people, remember, 8 out of 10 from birth, to some degree, you're not working 100% or optimally. That dimmer switch is down a little bit. So that's what we do. That's what we want to correct and work with. So these are all secondary conditions or symptoms or malfunctions that have responded from having a misaligned spine corrected. I mean, these are all, journal, periodical, referenced research studies, and there's some pretty crazy stuff on there. So do we cure high blood pressure? No. But if the high blood pressure is caused from a misalignment in the spine and the nerve system not causing that system to work right, then we can absolutely help that. And these are all things that have cleared up. Now, not every form of high blood pressure is because of a misaligned spine, and we know that. But again, back to the baseline of your health. Let's get all this corrected and get you working properly. And we see all this stuff really hang up. A lot of people will hear, well, chiropractors think they can cure anything. No, we don't cure anything. Remember, it's that innate intelligence that works in you that cures everything. And that's just something you have to understand, that if the reason you have some crazy dysfunction or malfunction or dis-ease leading to disease is because that nerve pressure is there, and we remove that nerve pressure, then it's gonna heal itself. It's just the way it's made. So that's just to plant the seed for spouses, co-workers, and people that are suffering and they don't know what to do. Just because they don't have headaches like you do, maybe they've got carpal tunnel syndrome, or maybe they've got neck pain, or maybe they've got whiplash. Maybe something different that we can help. So it's not just the thing you're here for. And most people have a multitude of things when the body's not working right. So the simplest explanation that I can come up with is, this is the top bone in your neck. When it's aligned properly and there's no pressure on the brainstem and the spinal cord, and the brain and body can communicate, the fancy word again is subluxation, but that head-neck misalignment, when that's not there, you can be healthy. Your body's going to work like it was created to do. When it's misaligned, that's where sickness comes from. And I touched on this just a second ago, but when your body doesn't function right, it's not functioning efficiently or with ease, we call that dis-ease. And if you're not functioning right and there's a dis-ease for an extended period of time, now we have disease, and we name the disease. In Western medicine, we usually just name the disease and treat it with a medication. And a medication is never going to cure anything. Now, is it necessary in some cases? Absolutely. But it's not going to cause the body to work right. So what we do is not anti-medicine or opposite of medicine. They're just different. There's a time and a place for both. But when it comes to optimal health and wellness, your spine and nervous system is the baseline of that. Does that make sense? So, does anybody